tuatahi e tō tātou kaumātua, tēnā koe, mō kupu e whakawāteatia tō tātou huarahi i tēnei rā, mō kupu e hāpai ana i te kaupapa o te rā, nō reira tēnā koe. E te mana o te pō o te whakaaro nui, e te mana hoki o te whare wānanga o Tāmaki Makaurau, tēnā koutou, tēnā kōrua mā o kōrua mahi whakahaere kia whakatūngia tēnei hui, tēnei rā. Tēnā koutou katoa, e ngā kai kōrero, e whai aki nei, kōrero tia ngā painga o a kōtou mahi rangahau. Tēnā koutou katoa, kua tai mai ki te whakarongo, mauria mai o koutou tirohanga, o koutou whakaaro, mō te mahi rangahau nō reira. Tēnā koutou, tēnā koutou, tēnā koutou katoa. Yeah, it's lovely to be here, and thanks to Tex for paving the way for our gathering today. Thanks to Te Pou for giving me inviting me to come along and speak to you today. And when I looked at the brief of this particular conference, these words caught my eye. It said there are many challenges and opportunities facing the mental health sector. However, the recent publication of the New Zealand Health Research Strategy 2017 to 2022, this is an exciting time for research. And I thought, I had a bit of a shock horror moment, you know. I thought, I don't hope they expect me to come along and bore you for half an hour about this health strategy. And then I caught the last little bit which said, this is an exciting time for research. And I sort of sat there and thought, actually, is it? Because for the last 20 to 30 years I've been doing research, and for me it's always been an exciting time. So what I sort of thought was what I'd do is shelve the big vision document and maybe spend some time just reflecting on my own pathway through mental health related research, and maybe start to pull out some key points that may help those of you that are keen to position yourself into this brave new world which is approaching us in terms of being involved in mental health research. There's some dangers in this sort of approach, when you start to get into this notion of self-reflection, because people can perceive that you're sort of standing up here and sort of selling how great you are, you know. And I just wanted to affirm that even though I will be talking about some of my own experience, I'm not an eye specialist, and those of you in the room, I can see people around that have worked with me in the past. I'm not a person that sits out there and says this is all about me. When I was young, there was this lovely word that I was reflecting on, which is called skite. I'm not a skite, I'm not a show-off, but what I will be doing today is just talking a little bit about some of my own involvement in research to give those of you in the audience that are interested in this some kind of direction maybe for the future. I need to really start by talking a little bit about me and giving you a little bit of background, because I know most of you haven't got a clue who I am, and which will help to situate you in terms of what I want to talk about in terms of research. So I think people outside of Auckland refer to us as Jaffas. Those of us that are born and bred in Auckland know that there's a north and east and a west and a south, and we're all a little bit different. Well, I'm what you call a Westie. And for those of you that are old enough to remember the soap, you know, Outrageous Fortune, Westie's a little bit of rough diamonds. So my background is that I come from a very working class background. My father was a factory worker, and when he came home from his shift, he'd be out to another job to work as a cleaner. My mother worked in the local shop 2 days a week, and I had the most amazing upbringing that you could think about, you know. It was just absolutely fantastic. And when I went to school, Kelston Primary, at a very young age, I had this just in me, this sort of passion for learning. And I wasn't bright, but I had this real determination to succeed. And I was the first in my and my family to go to university. And my brothers were doing apprenticeships, and I used to say to my parents, what am I going to do? And they'd say, oh, it'll be all right for you, boy, because you're going to university. And I went to university the first time and I lasted 6 weeks. I got captivated by the mystique of the topics. I took sociology and philosophy and psychology, and in psychology I had to train a rat. And the rat was a dumb rat, I think, because I couldn't train it to do anything. And after six weeks, I was out the door. And at 19, I was traveling through Africa. And there I got exposed to this notion of culture, and the influence of culture on groups and the influence of culture on individuals. So I came back to university after a couple of years, and I did an undergraduate degree majoring in social anthropology. And at the end of it, the lecturers came up to me and said, oh, you're doing reasonably well, Why don't you come back and do a master's? But I couldn't see the relevance. I couldn't see the connect between what I was learning at university and what was happening at the real world. So I walked away from it. And then I really stumbled into nursing. I've got a mental health nursing background. I stumbled into nursing. I was working as an orderly in the outback of Australia, in Western Australia. And I just thought, oh, this is a great thing to be involved in. And very quickly after I got into clinical nursing, I ended up in education, again because of this love around learning. And I was cruising along to the mid-1990s and then decided it was time to take a really serious look at mental health. And on that basis, I did postgraduate education. And again, I was putting research in the background, really, because I was trying to do as much as I possibly could without doing the research. And then I did the research, and I sort of got into it. And the rest is really history, so there's been a lot of involvement in research during that time. And I suppose I got reminded because when I came in, I had a label on, and the label actually gave the title, the professor. And it was pointed out by one of my colleagues, oh, what do you think is something special? So I've taken it off. So I suppose that if you look at some degree of success, there is some indication of success, whatever that means. The markers are sort of there, I suppose. There's the titles. There's the publications, there's a bit of money trickling in, but it's not about me, It's about the groups that I've been a part of. It's the groups that I've been able to contribute to. Over at Mason Clinic, we've got a kaupapa Māori service there, and some of the Māori staff members refer to me as the brofessor, not the professor. So it's all of those sort of levelling things that you need. So I'm reminded of this proverb, E hara taku toa e te toa takitahi, engari e toa takitini. So basically, strengths, any strengths that any of us have got don't belong to us ourselves. They belong to that group of people that constantly support us, that stand with us, that move us through into that space where we can achieve. So I started to sort of think, well, what are some of the sort of take-home messages that might be helpful for those of us that are embracing this whole notion of looking at research? And the first thing really is that you've got to develop your passion, because otherwise research can be a very lonely, long, distant space to be involved in. And so what's my passion? Well, I've got a clinical background, and my passion around research is probably exactly the same as my clinical passion. That I want my energy, in terms of walking alongside people, to benefit those people that we serve. At the end of the day, that's what it's all about. And I've got this specific interest in forensic mental health, and I could probably spend a couple of hours telling you why I'm focusing on mental health and why specifically that interface between mental health and the criminal justice system, but I won't go into that. But I'm just absolutely fascinated by the complexity of that particular area of interest, the greyness, there's nothing black and white. It's a power-drenched space. in which we're trying to do our best for people. So all of those things totally interest me. I look at some of my colleagues and people that have done well with research, and what a lot of researchers do, and some of you might want to take this on board that are thinking about research in the future, is they create a research platform. And what they constantly do is build on to the incremental knowledge of understanding around very specific topics. Well, my problem is that I find everything in forensic mental health really interesting. So I tend to spread myself. I've probably been guilty of spreading myself a little bit thin. So what I'm probably saying to you is, if you really want to progress with research, focus on your platform and don't do what I've traditionally done. In terms of your creating that passion, is in order to create that passion, you have to sustain it. So you somehow have to stay close to those people that are intimately involved in the things that you're interested in. If you just sit in an ivory tower, that pretty soon you'll become fairly well distanced from the reality of the things that you want to look at and study. So in my own particular journey, for the last 20 years, I've been involved in what are called joint appointments. So I've always had one foot in the door of academia and one foot in the door of service delivery. So it's going over to Mason Clinic because I actually like those areas better than universities. I shouldn't say that, seeing my primary employer is AUT, but I actually like that clinical space because in the corridors I have the conversations. And it's the conversations that get me thinking. It's the conversations that start me having those aha moments, maybe potentially we could research in these sorts of areas. If you're staying true to the whole notion of joint appointments, really it's not about my interests at all. It's about the interests of the service that I'm attached to. And this was brought home when I had my first professorial joint appointment across in Melbourne, is that when I arrived at the doorstep and said, okay, here I am, what would you like me to look at? The person that I was accountable to said, you've got 6 months to get out there and talk to everybody in this service and figure out a vision for this service in relationship to research. I didn't need 6 months. I was keen. I knew I only had 3 years of a contract, so I needed to do some work and get on with it. But I spent 2 months just going out and talking to a variety of stakeholders, service users, clinicians, family whānau, about what it is they wanted me to focus on. And they came up with 3 areas. They wanted me to focus on the physical health care needs of service users. They wanted me to focus on that whole notion of this beautiful concept of recovery, but the extent that a lot of services are grappling with how to implement that into practice. So they wanted me to work on those sorts of issues. And the third issue that they wanted me to look at was this whole notion of reducing the use of restrictive practices. So that became the 3 key areas that a small team of us worked on over a 3-year period. So for those of you that are thinking seriously about research in the future, what I recommend that you do is stay really closely attached to those groups that drive what you're doing. So for instance, if you're a service user academic, stay really closely engaged with the service user movement, because it's from that group that you'll be sustained, it's from that group that you'll get at the ideas, it's from that group that your support will come. So stay with your passion, but be open to opportunity, because as you will develop, you will start to gain a whole lot of skills that is something to offer other teams. So I never say no to collaboration. If somebody comes to me and says, I've got a good idea, then I'm keen to work with people. Sometimes it may not go very far, but keen to work with people to look at how we move that idea forward and how potentially I can support it. I've only had one example in about 20 years of doing research of where I walked away from a project. And that was a project I was undertaking in Australia. An opportunity came up for a little bit of funding. 2 of us were contesting for the funding, 2 different teams. We missed out on the funding, and then I was asked by the group that got the funding to go and join their team. No sour grapes, there was definitely no sour grapes. But during the process, I had some concerns ethically about the way the research was going. As a team member, I had an obligation to try to work through some of that difficulty, but I couldn't settle it. And in the end, I walked away from the project in a very nice and appropriate manner. That research has gone on to be published, and I still have no regrets about my decision to walk away. So it's, at the end of the day, even though I'm pointing at that particular incident, the reality is collaboration is what it's all about. So take the opportunities, and I had a real opportunity now about 10 years ago. The Dean of our faculty, Max Abbott, is an expert in problem gambling research. I know nothing about problem gambling. I don't even know how to gamble, basically. But he came along to me and said he had a substantial fund that he'd got, and he had a little bit of money left over at the end, and he wanted to go out and look at the problem gambling issues with prisoners. I'd had a bit of experience in the past around researching in those particular areas, and had some ability to probably inform the team that were going out and getting the data. So he brought me into the team. I helped the people that were going into the prisons to get the data to work through that sort of complexity. He had a biostatistician that when all the data was coming in, that was doing all the number crunching. I then organised the tables, tried to order all of this massive data coming through. As I was developing the tables, Max overnight was virtually writing a report in relationship to those tables. And at the end of the day, we had this lovely report which went down to internal affairs. My job then was to take that report and bring it across into publication, and we published 2 articles, one about the problem gambling needs of male prisoners and another one about the problem gambling needs of female prisoners. So take the opportunities. As they arise, you might sit there and think, I don't know anything about this. But if somebody's approaching you, you've obviously got some skills to offer, and so get in there and give it a go. Crucial. Absolutely crucial. Get a team around you and spend some time getting the team right. We're doing research in a contestable space where you need multiple perspectives, multiple lenses on every aspect of the research and figuring it out what we come up with and how it can benefit those people that we serve. So get your teams right. And that may, as you get a little bit more au fait with the research process, that may involve you going out and getting a little bit of money. So I'm not talking about the huge grants like HRCs or Marsdens or those sorts of things, but as you're developing your relationships, then you can start to talk to people about that feasibility of just getting a little bit of resource to feed in and support your team as you're working through your endeavours. The whole notion of team is that if you are laying yourself open to multiple perspectives, then within your team you're going to have a degree of healthy tension. So sit with that intention. And what I suggest you do, the first thing you do is try to empower those members of your team that are coming from different perspectives. And I've felt what it is like to be disempowered in those research processes. The very first big project that I was involved in involved going out and looking at the mental health needs of prisoners throughout the whole of the country. And I was told when I was contracted in, yes, I was contracted in from a university, so there was the transfer of resource, but I was told that this particular project depended on getting the research that we needed within the prisons in Auckland. So I had a team of 12 people doing interviews. My job was to organise that team, get them into the prisons that required moving through the key gatekeepers, which are the prison officers, because they can provide all kinds of barriers. My role was to talk to the prisoners and get informed consent, and that can be challenging in its own way, especially in the language we use. The language we use, we have to modify. So when I started to talk to people prisoners about mental health or mental illness, they were When I started using their terms, like they use the term, excuse the language, but one of the terms that they use is broken-assed. Broken-assed refers to people that are down and out within prisons. When I started using their language, they were a lot more receptive about being involved. It was difficult. In one particular case, I'd noticed down in the courtyard one very high-profile gentleman flexing his muscles on the weights all day long. And I was doing a random sample of sentenced prisoners, and I was thinking, oh boy, I hope this guy's number doesn't come up of people that I need to interview for or talk to about the process of informed consent. And Murphy's Law, yeah, the one thing that you don't want to have happen does. So he comes up the stairs, gets about 10 metres from me, reads me my pedigree, and then turns around and walks in the other direction. So the difficulties to me indicated that maybe I should be part of the bigger team and be involved in the research to its natural completion, and that opportunity was denied of me. So what I do when I work with teams, or we together form a team, is if you're in the team because you've got the skills, and if you've got the skills, you're there from the beginning to the end. And if you're contributing, you're not excluded from publication, you're not excluded from presentation, you're part and parcel of what's going on throughout the whole process. Sit with your tensions, build up your relationships, problem solve around them. You'll make mistakes, you'll say the wrong thing, you'll get somebody a little bit annoyed, but if you build the relationships up, you'll gradually work through to some kind of positive resolution which will add to the quality of the research that's occurring. Have a goal. It sounds basic, eh? But your goal is not to complete your research. And being in academia, I see it time and time again. Master's students, even PhD students do this lovely research, and at the end of it, it just sits there. And they get the satisfaction of, oh, I've got my certificate, I've got my title, but the reality is it's wasted space unless it's converted into publication. Because when it's converted into publication, what it does is it moves the baseline of understanding forward. And without it, the baseline stays backwards. So everybody's moving backwards instead of everybody moving forward. So I'm really passionate about that your goal should be, if you're in this space, if you're doing it, that you're going to publish. Robin referred to the whole notion of translation, and I'm fortunate in my joint appointments that I can move across and assist a little bit with that. But what we do is got to somehow improve the lot of those people, as I said before, that we're serving. So, and you can do that easily, eh? The people that you're engaging in with research, the people that you're getting on board to do the research, take the research back and talk to them. Work with them, offer your assistance for them to assist them to translate that back into some kind of practice. Then, if you feel comfortable with that, you might decide that you want to move your research into a more political domain. How do you do that? Get out and talk about it. Look at every opportunity, like today, for those who are just going to present later on, to talk to people about what you're doing. Take your publication, send it to Wellington, post it to this person. In your reading, you'll know you've got this expert there, this expert there. Feed it out to them. Really try to look at the political reality, the political potential of what you're doing. Now, I'm not saying that I do any of this well, by the way. I've been far too guilty of doing one project, finishing it, thinking, great, published, fantastic, and then moving on to the next, and not often knowing what the hell happens to that piece of research. And sometimes the things that I think we've done that are really we've done well, I've never heard about since, and other things that I thought, oh, that was interesting, seem to crop up time and time again, and it's hard to sometimes predict that. In about 2003, I did a little bit of research. I was working with an academic psychiatrist that had done some work with new registrars about their experience of aggressive behaviour, really, in their practice. And he said to me, oh, this would be a really good project to do with new graduate nurses. So I went and talked to new graduate nurses, and I said, what would you say if we're going to do this little bit of research and maybe talk to you about it? And they said to us, actually, it's not the aggression that we received from service users that upsets us. It's the aggression that we receive from staff. So we looked at both the experience of clinical experience of service user aggression, and we looked at staff aggression as well. And it's the staff aggression stuff, it's the staff aggression stuff that I got emails about for about 15 years from places like China, the US, Europe, because it seemed to strike a raw nerve. In terms of being a little bit political, at the Mason Clinic, we knew for a long time that we weren't getting into our prisons and really delivering good in-reach services. We didn't have a really good model of care. So what we did is we worked with our neighbours down at the Forensic Services in the Waikato, and we developed a new model of care. And then we got some money through the HRC to evaluate that. It was really hard research. It took us 5 years to complete. And we got 3 publications out of it, which was really great. And about a year ago, I got an invitation from the editor of World Psychiatry. If any of you know the psychiatric literature, peer-reviewed literature, World Psychiatry is the highest, and it's got an impact factor of 20 plus. And he wanted an editorial done on this notion of models of care. I went to my 2 psychiatrist mates and said, I need you to support me with this one. This is a fairly big one. And so I got back to the editor and said, can I have another couple of people? Remember, I'm a nurse, by the way, and this is a psychiatric journal. And the editor said to me, yeah, they can come along as well, but you're the first author, not them. So that was sort of a little, oh, that's a nice thing to have said to a nurse. And then the director of mental health services is encouraging all forensic mental health services in New Zealand to develop this model of care. We had a member of our team who is now in Canada, got $1.5 million to look at developing this model right throughout the world. And I'm part of an international collaboration which is moving this model forward to adapt it for more international involvement. So the little projects can be projected through and worked through to a higher level. So just in conclusion, that's the next presentation. In a nutshell, stay humble. You know, there's sometimes academics sort of think, oh, you know, I'm a doctor and I'm doing this fancy research. Stay humble, absorb the tensions, play the politics, and in all of that, have a lot of fun. So thanks very much.